Good afternoon, everyone. Thanks for joining us for this update on COVID-19 vaccination in Texas. I'm Chris Van Dusen with the Texas Department of State Health Services, joined once again today by Imelda Garcia, DSHS Associate Commissioner for Laboratory and Infectious Disease Services, and the chair of the Texas Expert Vaccine Allocation Panel. Also on hand today, once again, Dr. Saroj Rai, the SHS Scientific Advisor, who's here to answer any technical questions that you may have today, so we may call on her depending on what you're interested in talking about today. To actually ask a question on vaccination, please type it into the question box. Include your outlet so we can recognize you appropriately. We will work to get through as many questions as we can in the time that we have today. As a reminder, as usual, the briefing is being recorded. We will send a link out once it is posted and available. Kind of can vary, but usually an hour or two after we get finished. So with that, I will turn it over to Commissioner Garcia for some opening remarks.
Thank you, Chris. Good afternoon, everyone, and thank you for spending your afternoon with us today. We announced some big news yesterday, so we figure we just dive right into that. As I'm sure you've already seen, we've identified the next group for vaccination as people ages 50 to 64. They will begin to be eligible starting this coming Monday. And the simple reason is that when we looked at the epidemiological data, this group bears significant risk of severe disease, hospitalizations, and death. 20% of the deaths in Texas throughout the pandemic have occurred in people ages 50 to 64. And when you add people 60 and older, the combined group accounts for over 93% of all COVID-related deaths. That's a really big number, so I'm going to say it again. When we add that to the people 65 and older, the combined age groups account for over 93% of all COVID-related deaths. So as members of the expert panel, everyone felt very strongly that following the evidence, following the data, and adding this group next does the most to protect Texans from the worst of COVID-19. We debated and discussed this next eligible group for several weeks, looking at ACIP recommendations, looking at our Texas data, and at the end of the day, the data is overwhelmingly clear that people 50 to 64 are the next group with the highest risk for death. So opening up vaccination to this group next will let us continue to reduce the number of deaths we're seeing across the state and help relieve the strain on our hospitals and the rest of the healthcare system. This is a good time for us to make this transition because more than half of people 65 and up, about 53%, have gotten at least one dose of the vaccine, and we're approaching nearly 1/3 fully vaccinated. We do encourage our providers to make sure that they continue to seek out and prioritize our seniors 65 and up, specifically where there is still a need. And what we estimate is that there's about 5 million people in this 1C priority group, and more than 1 million have already been vaccinated. So just to catch you up on the numbers, we're now at more than 7 million doses administered. That's close to 7.4 million, in fact. And when we break it out a little further, 4.8 million people have gotten at least one dose, and 2.6 million people are now fully vaccinated. Now, if we look forward to next week, after the big influx of Johnson & Johnson that we received last week, nearly 250,000, we're actually expecting to see fewer first doses arrive in the state next week. This is happening for two different reasons. The federal government has sent out all the Johnson & Johnson vaccine that have been manufactured this week, so states are getting a lot less J&J this coming week. We also got word this morning that Texas will be receiving some, but we don't have the final numbers yet, so you won't see that reflected in our allocations that we post tomorrow. Additionally, the federally supported sites in Arlington, Dallas, and Houston have finished their 3-week cycle of first doses and will begin administering second doses for the next 3 weeks. Still, we're expecting a total of more than 800,000 doses to arrive this coming week, and that includes about 625,000 doses that the state will be allocating for providers this coming week. And then there will be an additional 200,000 doses directly from our federal partners to pharmacy locations and federally qualified health centers. While it's a bit of a letdown that after 1 million+ doses we got this week, this week will still be the third largest allocation we've received so far, and that means hundreds of thousands of people will get vaccinated this coming week. So Chris, I'm happy to take any questions.
Thanks, Commissioner Garcia. First one comes from Gina Sunseri at ABC News. Are you seeing hesitancy to get vaccinated?
Right now, we're seeing overwhelming demand. We continue to hear from our providers that they still have quite a few folks that want to be vaccinated.
Kayla Harris with Houston Chronicle asks, or mentions that last week you mentioned that the federal government's using old population data to allocate vaccines. Can you provide an update on the effort to change that data? How has that data impacted Texas weekly allocation, and how long have you been trying to address this problem, and why hasn't it been fixed? Again, it's Kayla Harris at the Houston Chronicle.
So we've actually been talking about this specific data point with our federal partners for months now. We continue to raise the issue with the previous presidential administration, and then we've had to have the same conversations over again since the new president's team has come in. The conversations are ongoing. We will have an additional data discussion this coming Friday to go over how they are representing some of the Texas data. Overall, we think that 1 million adults are not getting counted towards Texas, and so ultimately that does reduce the amount of vaccine that's coming to the state, particularly when we looked at, typically we get about 10% of the national allocation. So that's a significant number, but conversations are ongoing.
Question from John Moritz, USA Today Network here in Austin. What's the explanation for why some counties get more or less vaccine doses on a per capita basis than others with similar population? He says, for instance, recent figures show Lubbock and Smith counties receiving more doses per resident than Webb, Harris County receiving fewer doses per resident than Dallas and Tarrant.
So I think one of the things that's important to take into consideration that when we look at the state as a whole, we are really trying to hit and make sure that populations are as close to the proportion of the population that they are. And while week to week there may be some fluctuations across counties, the ultimate goal is to aim to have equity across all of our counties, knowing that some weeks we may be pushing for specific initiatives in certain jurisdictions, and other weeks that initiative may not be ongoing.
A couple of questions back on the 1C population group from William Joy, WFAA in Dallas. You said you looked at ACIP recommendations. While the age groups may account for deaths, ACIP recommended frontline employees be included with those 75 and older because of where the spread was happening. Why not target spread? And when do you expect that those individuals who are frontline workers will see vaccination?
So first, any frontline worker that has any comorbidities that make him at higher risk is eligible right now. And so I want to be really clear about that. We do not exclude them universally. If you have a chronic condition that makes you at higher risk, go get your vaccine today. Now, when we looked at the conversation and when we looked at the data and compared that to the ACIP recommendations, the data is very, very clear. And again, part of our goal is to help protect our healthcare infrastructure as a state because we need it there to help make sure it's there for all of us when we have our own emergencies. So at the end of the day, helping reduce hospitalizations and deaths is our top priority, and that is ultimately why we chose the group 50 to 64.
And a bit of a corollary question from William Joy again. What's your message for employees like food service workers who can't work from home, but also can't get a vaccine now as the mask mandate and capacity limits end?
So first and foremost, how we act in public matters, and wear your mask at all times, wash your hands, do all the same preventive measures that you possibly can. You can still help by managing your own social distance from other people. And so that's my recommendation. Now, we do know that the vaccine supply is going to be increasing in the coming months. And so we just need you to hang on there for a little while longer. More vaccine is coming.
Moving on to Jessica Shorten with the Montgomery County Gazette. With 1 million Texans in the 50 to 64 age group estimated to already have been vaccinated, does the SHS believe they will be able to move through this group quicker than the phase 1A and 1B groups?
Yes, for two reasons. One, because it's a much smaller population, but two, the vaccine supply is also much more robust than it was in the early weeks of us doing our vaccination efforts.
And Rudy Morelos at KRGV in down in the Valley asks, with the expansion of 1C, does the state expect to receive more vaccines to continue working through what's left of 1A and 1B?
So as I mentioned earlier, our vaccine will actually go down this coming week. It's still a lot of vaccine that's arriving, but it is less than what we have out in the field right now. So we won't be getting any additional extra vaccines specifically for these populations. Now, the piece I do want to add is that with the new federal directive to include teachers and childcare workers, they have told the retail pharmacies to prioritize them through the month of March. And so in some ways, there is a bit of a cushion there for that particular group.
And that may be a good, not a specific question we've gotten, but maybe a good opportunity to take a reminder of sort of what that looks like for teachers and different pathways that they may have, and not just teachers, but school staff, custodians, bus drivers, food service, kind of what are the different pathways they have to get a vaccine at this point?
So first and foremost, our providers know that you're currently eligible, so seeking out through the normal providers out in the field. But as I mentioned, the federal retail pharmacy program, they have received direction that they are to prioritize school staff and childcare workers throughout the month of March. Now, they have to honor their appointments for those populations that are not within that category. But other than that, that would be a great option for you. Now, at our hubs, at our other provider clinics and stuff like that, you are also eligible. So please reach out as quickly as you can in order to be able to try to get your vaccine. Now, we are partnering with the Texas Education Agency in order to start partnering up those school districts that may not already have a vaccine provider. So there's some school districts that have signed up directly with us to receive vaccine. We will be including them for those that requested doses in next week's allocation. And then we will continue to work with our current providers that are actively partnering with ISDs in order to be able to vaccinate them in the coming weeks. And so this is going to take us a little while. We're going to continue to go the next week after week. And in partnership with TEA and our sister agency at TDM, we will continue to move through this population as well.
Question from Ashley Lopez at KOT here in Austin. Do you have an estimate of how many Texans overall are now eligible for the vaccine with this new category? I was actually, I can address this one. I was actually talking with our data folks with this last night. And sort of our best estimate is 12 to 14 million people. It's a little difficult to get at an exact number because there's so much overlap between groups. I mean, if you'll think about, someone may be a healthcare worker in phase 1A, but also have a health condition, or be 50 to 50 years old and also be a school teacher. And so it's a little difficult to get it in the exact number, but our best estimate, when kind of trying to account for the overlap between the different groups, is somewhere between 12 to 14 million Texans. When we get to next week, will be eligible to be vaccinated. Question from Chelsea Moreno at KXAN in Austin, staying in Austin once again, with just under half of the 65 plus population still waiting to be vaccinated. Why did the state decide to open up to the next phase now?
So when you look at the data and the literature on vaccine hesitancy for the group 65 and up, they expect to have about a 30% hesitancy for our seniors 65 and up. So in reality, the aim would be about 70% in order to be able to vaccinate those that actually do want to receive the vaccine. So it's not an estimated full half that we still need to reach out to. We're estimating we still need about another 20% to be able to attain everybody receiving a vaccine that actually wants to be vaccinated.
Question next from Tiffany Liu. Do you have an estimated time where herd immunity will be reached? This is a very common question we get. Is there a plan for when essential workers can get vaccinated?
So the science is still ongoing about the herd immunity. And I think one of the big things to remember is herd immunity at the state level is one thing. Herd immunity within your community and where you're navigating is another piece. So we continue to have our scientists and our epidemiologists review the data and work through estimates on that. But right now, we don't have a definitive answer. Now, as far as when first line and essential workers will be eligible to be vaccinated, again, if they have comorbid conditions that makes them eligible right now. And so we want them to go get vaccinated right now. As the vaccine supply increases, and I do believe that we'll be able to move fairly quickly through this 1C population because of increased supply coming in the next couple of months, we will be announcing the next eligible population soon.
A question from Brett Jaspers at KERA in Dallas. Will opening vaccines to people over 50 slow down the effort to vaccinate teachers and other people who work in schools?
So I don't think so. We believe that our providers have robust capacity and they are working hard in order to proactively reach out to teachers. We know that in some parts of Texas, they have already begun some of those initiatives pretty aggressively and maybe fully done with some of their ISDs and maybe ready to take on the 50 plus.
You mentioned, Imelda, earlier that there's still, providers certainly can still prioritize within the different priority groups as they, kind of as appropriate in their communities. I wonder if you can talk a little bit more about that.
Of course. So first and foremost, because we know that we still have more seniors that we need to vaccinate, we are directing all of our providers to still put them at the front of the line. They are the most at risk, and we want them to be vaccinated as quickly as possible. Now, within that, our providers can carve off pieces of their allocations in order to cover unique populations such as our teachers and child care workers, as well as partialing off some of it for the 50 to 64.
Nicole Cobbler at the Austin American Statesman asks why Texas, and you addressed a little bit, but why is Texas behind most states when comparing the percent of vaccinated residents? Do you attribute most of this to the CDC using the 2018 population data, and what else could be in play?
So a couple of different things. Obviously, there's a little bit of a data delay between the state and the CDC numbers. At the end of the day, the amount of vaccine that each state gets helps determine how many people are actually vaccinated and how quickly we can do that. So the fact that Texas is receiving less than what we should be is directly impacting those numbers. Now, the other piece to remember, and I know it was just a couple of weeks ago, but the winter storm that took us a week out of really active vaccination had a significant impact on those doses being administered. And so as a nation, we are a bit behind now because of that winter storm. And I don't want us to forget that occurred because it did have an impact on how timely we were vaccinating.
Molly Smith in El Paso at El Paso Matters asks, as a state that shares the longest border with Mexico, will Texas health officials push for eventual vaccine sharing with Mexico's northern states? How closely is Texas monitoring vaccination efforts in the border communities in Mexico?
So we're a long way before we would consider sharing our vaccine. We don't have enough of our Texans vaccinated in order for us to consider that. So we'll see how the vaccine supplies and if and when that time comes. Now, as far as us monitoring the uptake on what's happening on our Mexican country to the south, we know that they have some ongoing challenges, and we are looking at some of that data. However, it might be sporadic that information is coming to us, but it is something that we continue to look at.
Question, Ashley Lopez again at KUT asks, is there an expectation that Texas will eventually be getting increasing doses of the J&J vaccine in the near future? Maybe talk us through kind of what that timeline looks like, at least what we know so far.
Great. So what we know so far is that this coming week, March 15th and the week of March 22nd, we will be receiving very limited Johnson & Johnson doses. However, they have indicated to us that we expect to receive a much larger supply by the end of this month, at the end of March. What numbers those turn out to be, I don't know. We don't know if it'll be the same to the initial, 220,000 that we got, but they are supposed to be continuing to ramp up supply. And then the other piece to remember is that Merck has now said they're going to help them manufacture the vaccine, so that should help accelerate that process quite a bit.
Chris Fox asked just for a reminder, what's the total dose count in Texas so far, as far as vaccine that's been administered?
So right now we're at 7.4 million doses administered.
Got it. And looking down here, I have time for a few more questions here. Valerie Gonzalez asks, is there data available on vaccine doses administered broken down by race and ethnicity? If so, can you share some of those statistics? I don't know if you have them at your fingertips.
I don't have them at my fingertips, but we definitely do. I would encourage you to go to our website on vaccine data. We have quite a bit of data that's posted there. Now, if you're wanting it crosswalked between age and race, ethnicity, and things like that, we don't have that readily available, but it is something that the team does look at.
And maybe if you can say a word about, I know this has come up recently, sort of what the change has been in getting the data and the completeness of the race ethnicity data over time. So,
beginning of February, a technical change was made to our NTRAC system, and that helped simplify and streamline the data entry process. Right now, the majority of the data coming into NTRAC is through the front end, particularly through the mass vaccination sites. So with that change in making it easier and making it required, the data has really, really changed and improved. So while we had 45% have been missing prior to that change, right now we have about 2% of race and ethnicity missing. So when you aggregate all that together, we have about a 20% unknown for race and ethnicity currently. However, we do continue to see improvements, and we expect to see that number decline over time.
Kayla Harris at the Houston Chronicle follows up on the population estimates. You mentioned that CDC might be underestimating Texas population by 1 million adults. Do we know what that translates to in vaccine doses that may be missing or may be due to Texas? So
I would apply a 10% rule to everything what we normally get. So of the national supply, we would be getting about 10%. So I don't have the exact numbers in front of me, but assume that we would get at least a 10% bump.
William Joy asked at WFAA, when you say soon for the next eligibility group, what led you to decide now was the right time to expand eligibility, and what will we be looking at for a start time for the next group?
So we hear a lot from our providers in the field, and many of them have raised concerns that things had started to slow down for them, and they felt like they were ready to go ahead and move on. Additionally, when we looked at our data for 65 and up and how much had been administered and how many counties really had seen significant progress over the past several weeks, those two things in conjunction really helped signal to the expert panel that we think it's time to go. Ultimately, at the end of the day, we don't want to slow down how well we're doing. We need to get as many Texans vaccinated as quickly as possible.
Dr. Rye, a question I think you might be able to help us out with here from Brett Jaspers at KERA. What do we know about how well the vaccine is performing against the new variants at this point?
Thank you, Chris. So the data for Janssen specifically, they actually looked at it under clinical studies, and where the in South Africa, where the participants that were part of the study, 95% of those had the South African variant, and under those conditions, the vaccine efficacy was shown to be 57%. So overall, I think, as we know, the vaccines perform. They are effective, but at a different rate depending on which variant we're talking about.
Got it. Thank you very much. Time for just a couple more questions. Kieran McCarthy in Victoria asks, sorry, let me scroll down here a second. The vaccine providers in the region said the 1C announcement came as a surprise to them yesterday, and just asked how the SHS is communicating this information out to providers.
So once we do have our final announcements made, we do then send out a subsequent email to all of our providers. Additionally, for those that may not have received that, there are bi-weekly webinars that we submit that information to them as well. And so that was covered on today's provider webinar earlier today. We will continue to make sure that they receive that information and are able to make plans. Part of the communication yesterday gave them headway on knowing when we anticipated actually moving forward with them to allow them time to make adjustments prior to next week's eligibility kicking off.
And then we do share information sort of through different pathways as well. We send a communication out to our counterparts at local health departments and our regional offices as well, so they were aware the announcement was coming. And I think there had been quite a buildup as far as this announcement was anticipated for this week as well. Finally, looks like we're down to our last question. Chelsea Moreno at KXAN. You mentioned vaccine hesitancy in the 65+ age group. Can you comment on whether other age groups are facing similar rates of vaccine ethnicity? Do we know how that compares among Texas and other states?
So I haven't seen anything that compares our hesitancy to other states, but what we do know is that the younger in the population that you get, we see less hesitancy. And so we have been making adjustments as we're looking at age demographics and estimates on hesitancy.
Well, thank you once again. Thank you, Commissioner Garcia, for being with us, answering questions today. Thank you all for joining us and submitting great questions, as you always do. I hope this continues to be helpful for you, and once again, appreciate your assistance in getting information out about sort of how vaccination is working in Texas and what we're seeing as we go through this process. It's, we still have a ways to go, of course. We're going to be a few more months doing this to be sure. And really appreciate your partnership and in sharing information and letting folks know the best ways that they can be vaccinated in Texas. Once again, thank you very much. As I mentioned at the beginning, this webinar was recorded. We should have the recording available for you here in the next couple of hours, and we'll send out a link when that is ready. Hope everyone has a great rest of the week, and thank you once again.